New side of the opioid crisis, medical examiners in multiple county offices are simply overwhelmed with the number of autopsies as drug-related deaths continue to skyrocket.
7 Action News reporter Bethany Moore has been looking into the numbers and is talking with medical examiners about how they are handling the increase.
As the opioid crisis continues to plague our communities, there's another problem that's popping up at your local morgue.
The times when we come in and we have no cases on any given day or 1 or 2 cases have pretty much gone.
Dr. Daniel Spitz has an unusual job, a job he loves, a job that has gotten massively more difficult. Dr. Spitz has worked as a medical examiner for more than 20 years, but the past few years have taken their toll. You see, sadly, when opioid deaths break records, so do the autopsies.
The number of cases goes up every year, and I think last year we had over 2,700 death investigations, and we had more autopsies than we've ever had.
Drug-related deaths have jumped from 280 in 2015 to 380 in 2017. Oakland County is not far behind, seeing their drug deaths increase more than 35% from 2015 to 2017.
These are cases that are only the drug abuse or drug intoxication cases. So, that is an extra workload on the office.
It's not just the added workload to the medical examiners. If they want to stay accredited by the National Association of Medical Examiners, each examiner can only perform 325 autopsies per year, with a recommendation of no more than 250 examinations per year.
Here in Macomb County, we are pretty close to those numbers, so we've hired some additional people.
With only 2 medical examiners for Macomb County, they've had to hire part-time pathologists to help with the load. There are 5 medical examiners in Oakland County, so they haven't had to hire outside help yet.
And you start reaching numbers, even 300, 400, 500 cases a year, you'd really have to examine, because that would be quite a workload on the forensic pathologist.
If an autopsy facility loses accreditation, they can still do autopsies and perform like a regular facility. But some of their authority is lost, especially in a courtroom.
It would mean it's a dream for me if they're not my expert, but it's a nightmare for me if they are my expert.
Ali Sharara with Marco Law says a medical examiner from a facility that's not accredited will have their expert testimony greatly scrutinized. In the end, it could cost them a case.
If a medical facility loses its accreditation, it's definitely going to be a point on cross-examination of that expert, whether we like it or not.
Experts say if these trends continue, they'll have to do more than just get part-time help.
It's really being stretched. Again, this runs 24/7, 365 days. It's something that will need to be addressed in the near future.
Bethany Moore, 7 Action News.
If you need help with an opioid addiction or you know someone who needs help, you can call the Substance Abuse and Mental Health Services National Helpline. That number is 1-800-662-HELP, 1-800-662-4357. It is free and confidential and open 24 hours a day all year long.